We're lucky to live in a new era of breast imaging, actually, with very performant modalities and for breast cancer early detection. You all remember, I'm sure everyone remember the old mammogram, the analogic one with films and negatoscopes and all. Then we moved to the digital mammogram, and then the great technology came with the tomosynthesis. The tomosynthesis or the 3D mammogram, it made everything different because we could scroll through the breast with 1 millimeter slices, and this made it possible to detect very, very small cancers, and the detection rate of small cancers, it increased by 34%, which is really, really amazing. And the good thing that the cancers that we detect are more invasive. The cancers that we want to detect, not like the DCIS and the pre-cancer stuff. So then there was the tomo-guided biopsy, which helped in that. Then many other like technology advances, like even the MRI. MRI is not a new technique, but there are new biomarkers that we can use to predict treatment. Then there are the biopsy, the excisional biopsy under imaging, and then there is this non-wire localization pre-surgery. So all this made it very interesting and it's like for us radiologists, we just combine modalities, we just move from one to the other, and it's really, it has a big effect on having the good diagnosis and the good management of the case. Technology already transformed the breast cancer diagnosis. When we say diagnosis, that means a patient comes with symptom. So now we surpassed that. We are in the breast cancer early detection. We're talking about finding small cancers that can never be felt by the patient or even by her doctor. We're talking about millimeters. We're talking about pre-cancer stage. So this is the big evolution that technology helped us to achieve, because now we're just targeting the non-palpable tumors. This is when we talk about early detection, and actually a lot of advances helped us to find, to reach this area. And then again, the AI now solutions will even be, we will have better technology. Of course, we're waiting for it just to help. Here in the American hospital, we use the AI solution with ultrasound. It's a new machine it's an ultrasound machine with an AI solution. And it's really very interesting because it can predict, and it can, depending on the nodule itself, it can give us the BI-RADS, which will help new radiologists and in just determining if it needs biopsy or not. So I'm sure with mammogram we will have even more performant applications. So if you're asking about the limitations, no limitations. Actually, there is the cost burden, the cost limitation, but we're lucky to live here in the UAE, so normally we can have access to the latest technology. Normally, financially, we don't. I know that I have colleagues in Europe, when they knew that we have the tomosynthesis biopsy, for them it was something. For us here, whenever we estimate that it will just be a plus for patient care, we just acquire it, the hospital just approve it, and this is we're lucky to be in this part of the world. AI is the future. In fact, we radiologists are overwhelmed with thousands of images from multiple imaging modalities that we see every day, and soon we will just reach the human limit. So we need help, and the AI will be the solution, because when we automate repetitive tasks, for example, and all, we will just gain time. We will gain time that we will we can skip unneeded tasks, and then the AI can help with that. And again, the AI with the it's a machine learning, it's a kind of intelligent algorithms. It's just a complicated kind of combination. So it will increase the performance and the quality of radiologists. And normally when radiology there is a lot of difference. We call it the inter-observer, you know, like from one to one. If one radiologist can see something, the other can see. If he is very, like it needs experience, so experienced one will just think of things differently. So with AI, we can avoid all this kind of inconvenient, I would say. And again, we're all waiting for the promised uncovering of hidden data that the AI, we're just waiting for this. We want to see a real application of it, and I think that it will be like a great add to breast imaging. It is actually, we radiologists cannot be just spectators. We have to be involved. I don't think that AI will replace the radiologist, but I believe that a radiologist who uses AI will replace a radiologist who doesn't use AI. So this is why we really have to be there. We really have to start it now, because this will be the future. Actually, we're using AI in many aspects in breast imaging. Like we have the CAD, it's conventional AI. It's just the old AI, like the computer-aided system with the mammogram. When we do stereotactic biopsies, it's a kind of AI. Like the new tomosynthesis, the synthetic images, it's a kind of AI. Of course, like with machine learning and deep learning, we will go further and further, and this will be a big help. I think that this is the future, and we have to be in it. This is it. I would not call it substantial, actually. False positive, there are false positives, of course, and there are false negatives. And we always try to combine modalities just to have the best outcome. I think what you mean is the overdiagnosis. Like whenever we discover this kind of small cancers that may not be like pre-cancer stuff, DCIS that may never be cancer in the future, I think this is the positive, because there is a lot of talks about, in fact, the overdiagnosis. What does that mean? We discover, like it's mainly with calcifications, for example, we discover a lot of DCIS. DCIS, it's like ductal carcinoma in situ, which is a pre-cancer. So a lot of these DCIS can stay the same for long time without any change and without being like dangerous for the patient. But a lot of them as well, they may develop into invasive cancers, and till now we don't know which will develop and which will not. So we radiologists have to find all these, and then we have to know how to better deal with them. Like this will include advances in pathology, it will include advances in treatment, because we don't know still which one will be really dangerous and will turn on into real cancer, invasive cancer or not. So the AI actually is very, very interesting in this domain, in this field, because with AI, as it's a kind of it's a kind of complicated, it's a kind of, till now, honestly, I cannot understand which criteria, because it's a deep learning and a machine learning, so our human, our human mind may be not following the steps, but with the AI, maybe we can arrive at one point where we can decide that these calcifications are the dangerous ones and these calcifications are not. And this is what we are waiting for. This will be this will be the innovation. Actually, your working Prognica, I think, is working with this kind of project, and it needs, of course, validation. It needs testing and all, but it's very promising, actually. The problem always with dense breast is that the density of the breast can hide cancers. So young women, normally they have dense breasts. This is why mammogram is not very performant for these kind of ladies, because it's white on white, so we can miss cancers whenever it's a dense breast. So this is why we combine with tomosynthesis. It's better because we have sections inside the breast, but it's still not very performant. This is why we combine with ultrasound. Sometimes we go for MRIs just to be able to detect these cancers properly. Of course, we have limitations, and again, the AI will help a lot in this, because first, by eliminating the density of the gland, and second, by concentrating on areas of concern. And this, again, the deep learning or the machine learning or whatever, it may be able to detect these areas where we have to concentrate on, and we're waiting for it as well. So private hospitals, we are partnering with. We have we work we have a good relationship with the DHA and with the non-profit organizations for breast cancer. So we're just trying to raise awareness about the importance of early detection, of screening, the risk factors and all. So we have a lot of talks, we have a lot of interviews, we have a lot of we're trying to implement social media. We're just a month of October, we have discounts to, we're trying to reach different categories of women, and it's working actually, which is good. When I see women that they never had mammograms in their lives come to profit from the offer or whatever, it's really a pleasure, because it can save lives. So yeah. The American hospital, they are embracing the new emerging technologies like AI to be in the heart of their digital transformation. They are collaborating, and they have partnerships with big names in the industry, and they are now on the way to build their data lab. Actually, the American hospital vision is just to support the transformation of healthcare in the UAE by or through developing the emerging technologies, or the next generation intelligence. So I believe, and I'm not a decision maker, of course, I believe that startups will help a lot. They can be part of this transformation, which is going on and will go on for the next 10 years maybe.